All right, Josie. All right, good morning. It is a beautiful morning in the state of Washington. We're looking forward to Father's Day this weekend to honor our fathers and grandfathers. A note, if people want to honor their father this weekend, we think a really good way would to help your father or grandfather get a vaccination. Nothing better than saving a father's life, and we can do that this Father's Day if we can encourage our fathers to get the vaccination. We know that this saves lives. It is saving lives. It'd be a great Father's Day if we have more fathers get a vaccination this weekend. We have good news to report this morning. One of the things, good news we can report is that we believe that our incentive program is having a positive benefit in saving lives and getting people vaccinated in the state of Washington. Since we announced the incentive program, the lottery drawings and the like, we had been experiencing a very, very rapid decline in our vaccination rate. We essentially had fallen off a cliff in the previous 2 weeks, almost a 50% reduction each week. We have arrested that decline largely, and we feel that's good news because we want to increase our vaccination rates. We want to open up. We're trying to get to 70% as soon as we can. And so I'm really glad that this appears to be encouraging people to think about the vaccine. And what we're finding is when people think about the vaccine and they look at the evidence and they look how effective it is, they look at the fact that it's 95% effective, they understand when they think about the fact that the people who are in our hospitals today struggling for breath are the people who did not get vaccinated. When they talk to their physicians and they look at the compelling evidence now that hundreds of millions of people have safely received this vaccine, people are getting vaccinated. So that's good news. And we continue to increase our numbers by tens of thousands each day. That's really, really good news. So we feel good about that. But we want to expand that access of this incentive program. When we started the incentive program, we were unable to include active military duty and those in the Veterans Administration system who had received their vaccination through those systems because the federal government would not give us the identity of those individuals. I'm really happy to say we have found a way to honor our active military duty and our veterans in this regard. And we're announcing today a program we called a Heroes Thanks program. We want to say thanks to our veterans and our active duty personnel. So we are initiating a separate incentive program and a separate lottery for those Washingtonians who have received their vaccine through the Department of Defense or the Veterans Administration. And the way this is going to work is that we will announce winners once a week for 3 weeks, starting on July 30th. Each week, a person in this pool, either a veteran or an active duty personnel, will receive an award of $100,000 in the first 2 weeks and a grand prize of $250,000 cash in the third week of the drawing. Clearly, these are some of our most treasured Washingtonians, and I'm glad to be able to provide this incentive program for them. There will also be Amazon gift cards worth $250 and state parks gift cards for $100. We hope this will help more fathers, grandfathers, grandmothers, nieces, nephews, sons, and daughters to think about getting this vaccine. I trust that it will. This program will be funded through the same policy of federal COVID relief dollars that we have in our previous. By the way, this is a separate pool, so this will be a separate pool under the lottery rules. One thing we want to ask folks, we don't have the names of people who are active duty military personnel. We are unable to get those from the Department of Defense. So we'll need those folks to submit their names to this program to sign up. So we hope that people will sign up. Those in the veterans, we have a different system. But in active duty personnel, you'll need to sign up for this, and we hope that you will do so. So we're really happy to honor these heroes. We hope this is going to save lives of these heroes. I trust that it will. So that's really good news. Talk a little bit more about this is our tremendous leader, Alfie Alvarado Ramos, who's going to talk about this program. Alfie, thanks for your leadership. Alfie, you want to chime in here?
Thank you, Governor, for the opportunity to address our veteran military community on this amazing incentive program. Top of the morning to my brothers and sisters at arms and their family members. I am Command Sergeant Major retired Alfie Alvarado, Director of your Washington Department of Veterans Affairs. I joined Governor Inslee to thank you for your service and to amplify the efforts made to ensure you are included in our state's vaccination program and also the incentives that are being provided. I lost last month to COVID, one of my dearest friends and former first sergeant. Had he been vaccinated, his wife, children, and grandchildren would still have him among them to receive his love and care. This was a huge loss. The vaccine saves lives, and we need you here. We urge all our veterans, service members, and their families to take the shots, present arms. You can be a winner in this special lottery, but more important, you will be a winner at life. Thank you, Governor, for this opportunity.
Alfie, thanks for your creativity in the lottery system working on this. Not every state is honoring their heroes as we are, and I'm glad we're able to do this. So present arms. I like that, Alfie. Thanks for your creative sloganeering in this regard, and we hope that this will help our heroes. Now, another initiative that we're working on to help people make decisions on the vaccine is we know who the most credible people about the efficacy and safety of the vaccines are our medical professionals, our physicians, our nurses, otherwise. These are the folks we turn to save our lives on a daily basis, from heart disease and cancer and now COVID. And so we want to use the energy of our physicians and otherwise to be able to share their advice with Washingtonians. This is very, very important. So in order to maximize the opportunity for the medical professionals to share their knowledge with their patients, we want to make sure that they can be compensated for providing that professional counseling. So today an emergency order is going to be issued by Insurance Commissioner Mike Kreidler, who will join us in a moment, which will allow medical providers to bill insurance companies for proactively reaching out to their patients to talk about the vaccine, the efficacy, the safety, and the reason this helps save lives. We think that this can put to work a very powerful force in our state, which is our physicians, who we listen to on a daily basis in our most intimate health decisions. We want to make sure that they can proactively do outreach to go out and contact, to call, to talk to their patients about why this makes sense to get this vaccine and just to share the basic scientific data. And the reason this is important is that, unfortunately, a lot of our citizens have been exposed to deception and outright falsehoods that have given them undue concerns about the vaccine. And what we have found is that when they get the truth, when they get the real lowdown from their doctors, they then realize getting this vaccine makes sense. So we want to empower physicians to do outreach to their patients. A Kaiser family poll found that 8 out of 10 people turn to their medical provider if they really want information about this vaccine. That's why it's critical to engage these physicians. We really do want to get to a position where this is a standard operating procedure for physicians, that they will proactively go out and talk to their patients in a way to get them to make this decision. We think this is a critical component of our vaccination effort. So this is a first step in this initiative. You'll be hearing from us in the near future about additional steps and an initiative to bring our physicians really into this battle. They've been doing great work to date. They've been working so hard, our nurses, our physicians, overtime, and they've been saving lives right, left, and center. We want to empower them now to even up that, to advance their ability to share information with their patients. So